Trump says the US will cut ties with World Health Organization. I thought at first the US leaving, as of November 2019, it's now an ongoing process. The Paris Agreement early on in Trump's presidency was awful in itself for a form of diplomatic isolation and stifling our efforts for climate change. But attempting to cut funding/ties, or leaving, the World Health Organization in the midst of a pandemic takes the cake of the president exercising American exceptionalism, and wanting to blame anyone but himself for finding a scapegoat if things go awry with the way the pandemic goes in the United States. Maybe he'll follow up on his threats to leave the United Nations, kick them out of New York, and tout America first, as we're embroiled in a financial free-fall, strained race relations, and controversy on transparent social media, among other things. Number 2020 is a roller coaster, and Trump's taking us all for a ride. On January 23, The WHO issued a statement, https://www.who in/newsroom/detail/23-01-2020 statement on the meeting of the International Health Regulations-2005 Emergency Committee regarding the outbreak of novel coronavirus 2019 gov declaring the COVID outbreak an international threat. It is expected that further international exportation of cases may appear in any country. Thus, all countries should be prepared for containment, including active surveillance, early detection, isolation and case management, contact tracing and prevention of onward spread of 2019 nCoV infection. Trump had just on January 22, 2 days after, https://www.cdc.gov/media/releases/2020/P0121 novel coronavirus travel case. HTML, the first confirmed case in the US, said that he was, https://www.cnbc. com/2020/01/22/CNBC transcript President Donald Trump sits down with CNBC's Joe Kernan at the World Economic Forum in Davos, Switzerland. HTML, not at all worried about the virus. Joe Kernan, are there worries about a pandemic at this point? President Trump, no. Not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine. On January 24, even as he was being warned, https://www. Vanity Fair. com/news/2020/04/ Trump received coronavirus warnings daily intelligence briefings PDB, constantly by his own intelligence community that China was lying and the danger was grave. He lavished praise on China, https://twitter. com/real Donald Trump/status/12208181153549230009, and its dictator for its transparency. China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well. In particular, on behalf of the American people, I want to thank President Xi. And as of January 27, according to contemporaneous emails from the US government's top vaccine expert, the administration still hadn't so much as requested a single virus sample. https://twitter. com/nicholas_status/125775727264102041168, from either China or the WHO. No one has officially asked China for samples as of this morning. That's a problem. Virus test and vaccine development is far more difficult without a genome sample. That, along with similar delays driven by Trump's desire not to test in order to keep the tally down, gave us the lost month of February. https://www. New York Times. com/2020/03/28/a/testing coronavirus pandemic. HTML, which echoes to this day in the deaths of over 100,000 Americans, and virus that has penetrated so deeply into the population that it's not clear that the economy will be able to even attempt a real recovery without a vaccine. We're in this situation because of a mind-blowingly incompetent administration, and now that administration is scapegoating and crippling the health organization that played a primary role in eradicating smallpox, nearly eradicating polio, developing an Ebola vaccine and continuing to keep Ebola contained, in the midst of the worst pandemic in a century. The more Trump tries to blame others, the more frightened he gets that it's not working. He ran away from that press conference like the coward he is. Trump is precipitating the end of US global leadership. We are just making it easier for China to gain more influence worldwide. That's fucking dumb. The next president after Trump is going to have an uphill battle trying to fix all the BS he has caused. In usual Trump fashion, instead of staying in the game to fix the problems, he blames anyone but him and then quits playing, 'cause in his mind, you're not the loser if you quit first. He's actually the worst kind of loser, the quitter and sore loser. The odd subtext is that this puts forward that the US is at least an order of magnitude worse at influencing an organization that it funds versus China's ability to influence the same. This speaks rather poorly of the quality of US diplomacy these days. How unfortunate. Seconds. Pompeo wasn't offered a chance to speak and explain this unusual outcome. Trump is hell-bent on doing as much damage as possible before November. Trump to cut ties with the world. It's actually quite astonishing how, in just a matter of years, the United States has managed to totally squander decades of work building its global influence and soft power. Ah yes, pulling out. That is sure to reduce China's influence in the WHO. The US has worked for the better part of a century to be the country building and pushing and advocating for international organizations. This was not altruism, although they are generally positive. It was because being the one building the international agencies ensures that those agencies act in a way conducive to American interests abroad. Pulling out will just make sure that the US has less influence on the world stage. But sure. Tell me more about America first and how Trump only cares about our nation's interest. Removed. Rhetoric like this is how you gradually normalize the idea of becoming an autocratic ruler. On Reddit, Americans at World Health Organization transmitted real-time information about coronavirus to Trump administration, https://www. reddit.com/r/worldnews/comments/g4boss/Americans_@_world_health_organization/. Also, Maria D. Van Kerkhove I is an American infectious disease epidemiologist. With a background in high-threat pathogens, Van Kerkhove specializes in emerging infectious diseases and is based in the Health Emergency Program at the World Health Organization, WHO. 2. She is the technical lead of COVID-19 response and the head of emerging diseases and zoonosis unit at WHO. N. By u/electric_screams. Here is a timeline of WHO's response to COVID-19. To note, as part of this timeline, the WHO released the international community's Strategic Preparedness and Response Plan on February 3, which outlines in its first pillar that national public health emergency management mechanisms should be activated with engagement of relevant ministries such as health, education, travel and tourism, public works, environment, social protection, and agriculture, to provide coordinated management of COVID-19 preparedness and response. The US declared a state of emergency on March 12. Really, the entire document is a fantastic read about how countries should prepare themselves for this disease. Should the US, or any country, have read this document and complied with the directions presented, this whole pandemic could have been minimized considerably. But it's far easier to blame the WHO for our leaders' shortcomings. 'Cause we failed to look into this deep enough. 31 Dec 2019. China reported a cluster of cases of pneumonia, https://www. WHO. int/csr/don/05 January 2020 Pneumonia of unknown cause China/n/ in Wuhan, Hubei Province. A novel coronavirus was eventually identified. 1 January 2020. WHO had set up the IMST, Incident Management Support Team, across the 3 levels of the organization, headquarters, regional headquarters, and country level, putting the organization on an emergency footing for dealing with the outbreak. 4 January 2020. WHO reported on social media, https://twitter.com/who/status/1213523866703814656 s=20, that there was a cluster of pneumonia cases, with no deaths, in Wuhan, Hubei Province. 5 January 2020. WHO published our first disease outbreak news, https://www. WHO. in/csr/don/05 January 2020 pneumonia of unknown cause China/n/ on the new virus. This is a flagship technical publication to the scientific and public health community as well as global media. It contained a risk assessment and advice, and reported on what China had told the organization about the status of patients and the public health response on the cluster of pneumonia cases in Wuhan. 10 January 2020. WHO issued a comprehensive package of technical guidance online with advice to all countries on how to detect, test and manage potential cases, based on what was known about the virus at the time. This guidance was shared with WHO's regional emergency directors to share with WHO representatives in countries. Based on experience with SARS and MERS and known modes of transmission of respiratory viruses, infection and prevention control guidance were published to protect health workers, recommending droplet and contact precautions when caring for patients, and airborne precautions for aerosol-generating procedures conducted by health workers. 12 January 2020. China publicly shared, https://www. WHO. in/csr/don/12 January 2020 novel coronavirus China/n/, the genetic sequence of COVID-19. 13 January 2020. Officials confirm a case of COVID-19 in Thailand, https://www. WHO. in/newsroom/details/13-01-2020 WHO statement on novel coronavirus in Thailand, the first recorded case outside of China. 14 January 2020. WHO's technical lead for the response noted in a press briefing there may have been limited human-to-human transmission of the coronavirus, in the 41 confirmed cases, mainly through family members, and that there was a risk of a possible wider outbreak. The lead also said that human-to-human transmission would not be surprising given our experience with SARS, MERS, and other respiratory pathogens. 20-21 January 2020. WHO experts from its China and Western Pacific regional offices conducted a brief field visit to Wuhan. 22 January 2020. WHO mission to China issued a statement, https://www. WHO. in/china/news/details/22-01-2020 field visit Wuhan, China, Jan 2020, saying that there was evidence of human-to-human transmission in Wuhan but more investigation was needed to understand the full extent of transmission. 22-23 January 2020. The WHO Director General convened, https://www. WHO. in/newsroom/details/23-01-2020 statement on the meeting of the International Health Regulations 2005, Emergency Committee regarding the outbreak of novel coronavirus 2019 Gov, an Emergency Committee, EC, under the International Health Regulations, IHR 2005, to assess whether the outbreak constituted a public health emergency of international concern. The independent members from around the world could not reach a consensus based on the evidence available at the time. They asked to be reconvened within 10 days after receiving more information. 28 January 2020. A senior WHO delegation led by the Director General traveled to Beijing to meet China's leadership. https://www.who in/newsroom/details/28-01-2020 WHO China leaders discuss next steps in battle against coronavirus outbreak, learn more about China's response, and to offer any technical assistance. While in Beijing, Dr. Tedros agreed with Chinese government leaders that an international team of leading scientists would travel to China on a mission to better understand the context, the overall response, and exchange information and experience. 30 January 2020. The WHO Director General reconvened the Emergency Committee, EC. This was earlier than the 10-day period and only 2 days after the first reports of limited human-to-human transmission were reported outside China. This time, the EC reached consensus and advised the Director General that the outbreak constituted a public health emergency of international concern, FIC. The Director General accepted the recommendation and declared the novel coronavirus outbreak, 2019 nCoV, a FIC. This is the sixth time WHO has declared a FIC since the International Health Regulations, IHR, came into force in 2005. 3 February 2020. WHO releases the international community's Strategic Preparedness and Response Plan, https://www.who in/publications details/strategic preparedness and response plan for the new coronavirus, to help protect states with weaker health systems. 11-12 February 2020. WHO convened a research and innovation forum, https://www. WHO in/newsroom/details/12-02-2020 World experts and funders set priorities for COVID-19 research, on COVID-19, attended by more than 400 experts and funders from around the world, which included presentations by George Gao, Director General of China CDC, and Zhenya Wu, China CDC's Chief Epidemiologist. 16-24 February 2020. The WHO-China Joint Mission, which included experts from Canada, Germany, Japan, Nigeria, Republic of Korea, Russia, Singapore, and the US, CDC, NIH, spent time in Beijing and also traveled to Wuhan and 2 other cities. They spoke with health officials, scientists, and health workers in health facilities, maintaining physical distancing. The report of the joint mission can be found here. https://www. WHO in/docs/default source/coronavirus/WHO China Joint Mission on COVID-19 Final Report, PDF, https://www. WHO in/docs/default source/coronavirus/WHO China Joint Mission on COVID-19 Final Report, PDF, SFVRSN = FCE87F4E_2.